It is my privilege to present the following program that was inspired by the way American businesses and organizations have responded to the events of September 11th. It's part of a special series produced by Heartbeat of America called Keeping America Strong. Each program spotlights a business or organization that is helping to do exactly that, keep America strong. Having served in the United States Navy for many years, I fully appreciate the important role small and middle-sized businesses play in the very fabric of our country, and I salute the professionals who lead these companies and thus keep America strong. They are the very backbone of our free enterprise system, and today on this program, you will meet the individuals behind one such organization. I'll be back later in the program to introduce the Keeping America Strong Award. And now, let's learn more about the organization we are honoring today.
Today, the eyes and ears of the 21st century are focused on new developments, new technologies, new emerging companies. We're on the scene to bring it to you as it happens.
We anchor from our new studios in Los Angeles and then go out all over America to get to the heart of the story.
I'm Bert Tenzer.
I'm Bella Shaw.
I'm Doug Llewellyn.
I'm William Shatner, and this is Heartbeat of America. Our show focuses on corporate America, its stories, its drama, its breakthroughs. We'll be going out today to report on an organization that is impacting our lives and shaping our future. An organization that truly is the heartbeat of America.
In the 20th century, a group of future Americans led by William Shatner ventured out into the universe. The challenge? To take the American spirit and courage to the final frontier of man, outer space. It was an exciting time on television, but it was only a fantasy.
It's the challenge to unite America and to keep our economy and our country moving forward.
This has inspired Heartbeat of America to launch a special series entitled Keeping America Strong.
In the 20th century, William Shatner took us off on a voyage into the universe to experience what life is like on other planets. But now, here in the 21st century, he is back to explore what life is like right here on our own planet. It's all part of a new series that we call Keeping America Strong. And as you know, part of Keeping America Strong lies in keeping Americans living quality, healthy, productive lives. And one of the ways to achieve that is by bringing a better life to people who suffer the indignity, both physical and emotional, of having missing teeth. Now, we're talking about teenagers who have lost teeth from sports injuries and accidents, and we're also talking about adults who have lost 1, 2, 3, or even all of their teeth, and they live with dentures. But thanks to advancements in dental technology, there is now an answer. It is called implants. And our guest today devotes his efforts to helping his patients benefit from the age of implants. We're about to find out just what it is he does and how he goes about doing it. He is, by the way, recognized as an Associate Fellow of the American Academy of Dental Implant Dentistry and a Fellow of the International Congress of Implantologists for 10 years. We're very proud to have him with us here today, and we're going to introduce him to you now. He has a practice in Galveston, Texas, and in Houston, Texas. His office is known as Today's Dentistry, and he is Dr. Thomas Carroll. Dr. Carroll, welcome.
Welcome
aboard. Let me ask you a first question. We're talking about implants, implantology. Just very briefly, tell me what an implant is. What are we talking about?
A dental implant is an artificial man-made substitute for a tooth root. It's usually made of titanium as the material of choice today.
So this is different from a cap or a false tooth. This is a implant that goes into the bone and the gum, right?
Yes.
Okay. That's just a brief. We're going to go into this in depth and give our viewers a pretty good idea of exactly what it is. Let me ask you this. We're talking about a lot of people who have dentures, and it's the problem. They have problems, and that implants obviously are better if they can afford that, because I know there is a cost factor involved. Let me ask you, why should someone who has dentures, why should they even consider going through the process of having implants?
That's a good question. The dental implant replaces the most important part that's absent, the tooth root. And thereby it helps to save the bone. this model depicts it real well.
All right, let's show this. This is a demonstration of a jawbone in various stages throughout someone's life. Mm-hmm. But if we start at the top of this picture and get a good idea, this is, I presume this is a normal jawbone. Is that right?
This is depicts a normal lower jawbone with all of the natural teeth.
Right.
As all of these teeth are lost due to dental decay or dental disease, such as gum disease, the jawbone is no longer needed and slowly dissolves away. This course of dissolving or wasting away of the jawbone would leave the patient with an unsolvable, let's see.
Well, it would be, well, no, it's not unsolvable, but it's obviously a terrible problem.
A terrible problem.
It changes the way they look, and it creates havoc, I would think, for having dentures on top if your jawbone keeps disintegrating and disappearing. How long a period of time does this represent? And this is not, you know, this is not overnight or a couple of weeks. This is years, right?
No, David, this is 15 to 20 years that it would take to get in this state of a denture cripple.
Interesting. Very interesting indeed. All right. Now, I think the best way also to understand what happens to someone who has this problem is to look at a picture of somebody.
Absolutely.
Here is someone whose jawbone has really kind of disintegrated. She obviously was a very nice-looking lady at one point, but take a look at her now. You can see she has real problems that have been caused by her dental problems, right?
Absolutely. And this patient that we treated, she actually has part of her teeth remaining, but still you can see a collapse of the facial tissues and a overclosed bite, and her teeth are actually in trouble here. They're getting overworked because she's missing a majority of her teeth.
Now, does she have dentures at this point?
She has partial dentures at this point.
So, I mean, this process goes on even though you're wearing dentures, right? The jawbone is disintegrating even though dentures are on your teeth inside.
Exactly. If we have remaining teeth but have more than one or two missing teeth, the jawbone begins to disappear. It first collapses inward, and then it actually collapses vertically over time to get to this category.
Yeah. All right. Now, here's a picture of this lady. Now, what has happened now to change this? Because this doesn't even look like the same person to me.
Right. We've totally revamped and rebuilt her bite, and in the process, we've stabilized her remaining teeth, made them rigid, more fixed, and now she can save those teeth. They're surrounded by dental implants where the tooth roots were missing, and now she has a solid, predictable bite that will carry her many years.
So even though a good portion of her jawbone did disintegrate, at this point, once you put an implant in, that stops the disintegration of the jawbone? Is that what happens?
Absolutely. It stabilizes it and stimulates and keeps that bone there just like a natural tooth root would.
Let's look at an implant. Let's look right in front of you. You have a model of a jaw. I tell you, if you put it down on the table, hold it flat. The camera can get a nice tight shot of it. Okay, tight shot of it, and we'll see what an implant looks like. If you can see, this is an example. Wait a minute, watch your finger, and then you see there. All right, take a look. You can see exactly what we're looking at. These are the implants right here, right?
These are actually the caps over the top of the implants.
The implant's down in the bottom. You can see it's titanium.
Uh-huh. There's a titanium post and another one that supports a permanent bridge.
And on the other side, this is very interesting too. Show me this. This is a denture, but it's on top of an anchor, a titanium anchor that's been put into the jaw.
Removable bridge. Here's anchors that are barred together, and they create a snap fit so that the bridge is snapped in permanently, just like button snaps on your blue jeans.
Let me ask you, I'm sure there's a difference here. What would you recommend, or does it depend on the person's mouth, as to whether they have a bridge that you anchor or whether you have individual teeth implants?
Well, that comes back to the individual, what their ultimate concerns are and goals. Our goal is to educate the patient and to try and fix or rectify their problems as simple as possible and as economical as possible with the least amount of treatment and time involved, but to meet their expectations at the end.
Is there a big difference that the patient would actually feel and experience between having a bridge that would be anchored by titanium anchors or the individual, implants for an individual teeth?
Yes, the individual implant anchors for the porcelain teeth give the patient an identical, lifelike simulation of what they had when their own
real teeth,
with their natural teeth. The denture bridge that's fixated with implants gives them security and function, but it still has the problems of collecting some food, and the patients, still get by with less than what's optimal.
And it's not as comfortable.
Right.
That's true. Let's talk about implant. What is it? What's the process? What do you have to go through? And who is a good candidate for this process?
Well, David, almost anybody is a good candidate as long as they're healthy, as long as they're don't have any underlying compromised medical condition. Obviously, uncontrolled diabetes, patients with heart problems or heart conditions would need to get that corrected first with their medical doctor. And then as long as they can heal properly, almost anybody is a good candidate for dental implants.
Children as well as older adults?
Teenagers, after the skeletal system has stopped growing, become candidates for implants if needed.
And obviously you could go up to, it doesn't matter what age you are, if 60, 70, 80, you could use implants in an 80-year-old person, couldn't you?
Absolutely. We have 2 80-year-old individuals right now in treatment, and even up into the 90s. When a patient comes in, they're assessed individually for what their desires are and what their capability is to receive dental implants.
When you say their desires, what are most of the most common desires for someone who gets an implant?
Well, patients have, some of them come in with psychological considerations on a removable appliance. I have females that have never let their husbands see their removable appliance, either a partial or full denture.
Right.
So that social stigma is real important for them. Others just want to be able to function and eat normal foods like the rest of us and have severe difficulties in achieving that.
So what is the process? How long? It's rather complex. Talk to me about it.
Well, in the standard of treatment, we normally let a dental implant lie dormant in the bone so that the bone can attach to it. Much like if an arm was broken, it would have to have time in a cast to become fixated and heal properly. And these implants lay dormant in the bone for a period of 4 to 6 months. At that time, we can attach a post to the implant, and then we're ready to do the normal capping process or the bridge work.
So what in essence is happening is this piece of titanium, which looks like the root of a tooth, is implanted into your gum, into the bone structure.
Through the gum and to the bone.
And over a period of time, as you say, 6 months, some I know last longer, it depends, the gum grows around that implant and anchors it, right?
Exactly.
Why titanium?
Titanium is considered a biocompatible material that the body doesn't recognize as foreign. So it grows to it just like grass grows to the curb. It accepts it and doesn't reject it.
And then after the bone has grown around it and it's solid in there, that's when you anchor a tooth cap into that, and no one really looking at your mouth would have any idea that you have an implant, right?
No clue whatsoever.
And from that point on, there's no special care for it. Am I right? I mean, it's not like dentures you take out and have to clean. It stays there just like a regular tooth.
the normal care of daily
Sure,
brushing
you brush
and
your
flossing.
teeth and all that, but I mean nothing special.
No, no. As a matter of fact, an implant is a godsend for a patient with a high decay rate. It never decays, it never needs a root canal, so it's actually a little bit of a bionic part.
Well, it's a fascinating subject, and it really gives you a great example of how far dentistry has come. I mean, it seems to me that's one area of medicine that has had almost more advancements than any other I can think of in recent years. It's phenomenal what dentists can do these days. We'll talk more about this.
We have been watching the operations of an organization which is doing its part to keep America strong, and we've been learning from its leaders about what they're doing to help move our country forward. This organization represents companies across our great nation that embody the spirit, dedication, know-how, and can-do attitude which has made America the great nation it is today. And now let's present the Keeping America Strong Award.
Now it's my honor to present our Keeping America Strong Award to Dr. Thomas Carroll, the owner of Today's Dentistry facilities in both Galveston and Houston, for the outstanding work he is doing to help keep Americans strong and help keep their teeth healthy. Doctor, congratulations.
Thank you. Thank you so much, Doug. On behalf of the staff and my patients and other doctors that we collaborate with, we gladly accept this award.
Congratulations for earning the Keeping America Strong Award, which honors innovators and leaders like you who are the heartbeat of America.
Our thanks to retired Rear Admiral Kevin Delaney for taking part in the presentation of the Keeping America Strong Award, the award that salutes small to middle-sized organizations who are helping to move America forward.
For more information on Dr. Carroll's services, you can visit his website. It is www.todaysdentistrytexas.com. That's todaysdentistrytexas.com.
That's it for Heartbeat of America's special edition, Keeping America Strong.
Now for a final word from William Shatner.
Well, that's it for this edition of Heartbeat of America. I'm William Shatner. Thanks for watching.